My name is Dean Hugh McDuffie. I'm council member representing Ward 5 in the District of Columbia, and I serve as the council's chair pro tempore, and as well as the council's chair of the Committee on Business and Economic Development. I am really pleased to be here this morning with Dean Hugh Mighty and Dr. Terrance Fullum from my alma mater, Howard University. Dr. Mighty has been Dean of Howard University's College of Medicine since 2015. He previously served as Vice Chancellor for Clinical Affairs at Louisiana State University Health Sciences Center in Shreveport, Louisiana. During his tenure at that school, Dr. Mighty guided the financial and strategic direction of the academic and hospital enterprise, including 3 safety net hospitals in the state. He's also served in multiple academic leadership positions, including chairman of the Department of Obstetrics and Gynecology at the University of Maryland. He's known for developing innovative statewide programs such as the Tomorrow's Children program that deferred incarceration for pregnant women with minor offenses in exchange for the development of job and parenting skills. Dr. Terrance Fullum chairs the Department of Surgery at the Howard University Hospital and is the medical director of the Howard University Center for Wellness and Weight Loss. Dr. Fullum is one of the country's premier minimally invasive and bariatric academic surgeons, having performed over 5,000 bariatric and minimally invasive surgeries, and leads the division of minimally invasive and bariatric surgery at Howard University. Since 2000, Dr. Fullum has developed or directed 6 bariatric programs in the DC metropolitan area, with 4 programs obtaining Center of Excellence accreditation status. Dr. Fullum earned his medical degree at Howard University College of Medicine in 1983. And in 2000 as well, he founded the Diverse Surgeons Initiative to address disparities in diversity training in the United States. Now, I wanted to bring together these experts because as we continue to move through this pandemic, many outstanding questions remain, both about the virus, how to protect ourselves, as well as questions about the vaccines. Many Washingtonians, particularly in communities of color, are understandably hesitant about getting vaccinated and might not be aware of all the risks getting COVID can pose to themselves or to their loved ones and others in their communities. I also know that there is a lot of information floating around on the internet or even shared among neighbors. And it's important that as a community, we're making informed choices based upon facts. We're holding this town hall to equip residents with the science-backed information they need to stay safe from COVID-19 and have our medical experts answer any questions that you all have. I've really been vocal about the need to have a more equitable vaccine program in the District of Columbia since this process started some months ago. We work with the Department of Health, Dr. Nesbitt, to adjust the vaccine process by reserving appointments for residents in the hardest hit communities. We also work with my colleagues and my team and others in the community to try to facilitate several community-based clinics to meet residents where they are and make the vaccine more accessible. We have to continue to make this process easy while also addressing the concerns that community members have. There is a real history in the scientific community with respect to Black Americans and exploitation, in fact. And so I understand some people may have hesitation about the vaccine and whether they should receive it. However, we are here to try to provide as much information about the vaccine as well as what's happening in the community to try to save lives. And so I got vaccinated a few weeks ago myself because I wanted to make sure that my loved ones and the people in my community are safe, and because 76% of Washingtonians who have died from the COVID-19 virus are Black. Our communities are really reeling from this pandemic, and so I think it's important that we have this conversation this morning. I want to turn it over at this point to Dean Mighty and Dr. Fullum and give them just an opportunity to make some opening remarks. Dean Mighty?
Good morning, everyone, and thank you all for joining. It's a pleasure to be here and to continue to spread the message about the importance of vaccination to our communities. as pointed out by Councilmember McDuffie, indeed, coronavirus has not gone away. It is still holding fast. And although we're moving to catch up with it, it will be with us for a while. That being said, we're still seeing, we've had over 560,000 Americans die. A disproportionate number of those are still in the Black and African-American community, Latino community. And we need to really continue to address the issue of stamping this virus down. The way to do that is going to be through vaccinations. I think it's vitally important for not only individuals to get vaccinated, but it also offers some protection to those around us. As we look in the Washington, D.C. area, for example, as businesses begin to reopen, it's going to be vital for folks who are on those frontline service workers to be able to return to work with minimal risk to themselves. And so I think it's very important that we get the vaccines out and people vaccinated and protected as we start moving forward, especially as we enter those summer months.
Good morning, Dr. Fullum here. I'm also very excited to be here and really appreciate the invitation. Certainly, I agree with everything that Dean Mighty has said. And just to add, I mean, it's still a health crisis that affects our community. And the importance of the vaccine, the number one importance is that it saves lives. Getting vaccinated reduces your chance of getting the infection and eliminates the chance of you dying from the coronavirus infection or transferring it to someone if everyone in your household is vaccinated. So the vaccine is very important, it is very safe, and it is very effective, and everyone should receive it.
Thank you both for those openings. And yeah, I kind of want to pick up on when you just left off, Dr. Fullum. You talked about the vaccine being safe. I'd love to hear you all talk a little bit about some of the common misconceptions about the coronavirus that you might be able to address for the audience and people who are participating this morning. There's been a number of things that have been said throughout the course of this pandemic, which has been more than a year now. And so if you could just talk about some of the common misconceptions that you all have heard about it that you'd like to share with the folks who are here.
So I think the coronavirus is very infectious. It can certainly be passed. And even though most who become infected with the coronavirus are asymptomatic, they still can transfer the infection. So early statistics, for every one person who got infected, they would then go and infect 4 other people. So you can see how quickly the virus can spread. That's number one. But for the 15% or so who do develop symptoms, there's significant symptoms in those who become very, very sick. And the illness that's associated with it can be very, very devastating. People can be sick for weeks and weeks at a time. It can require hospitalization. You may end up being intubated on a respirator. And then obviously the worst complication, of course, is death. On the backside of it, we're now starting to actually see a chronic condition that's starting to become evident in what we call long haulers or chronic COVID infection, and that these infections actually can cause permanent damage to the heart, to the brain. It can lead to chronic fatigue, muscle aches, just to name a few of the symptoms. So there's the risk of passing the infection and being asymptomatic. That's number one. And then there's the risk of being severely ill. And although most people who are ill do recover fully, we're now seeing a significant number of patients who are developing these chronic illnesses, and we're not able to really tell who's going to develop what. But what we do know is that it disparatively affects the African American community, and so it's significant for our community.
And go ahead, Dr. Mighty.
Yeah, I was going to say that Dr. Fullum's covered pretty well the spectrum of illness. Misconceptions. Number one misconception: you cannot get coronavirus from the vaccine. I think that's the number one thing I would like to tell people off the bat. You will not get coronavirus from the vaccine. There is no coronavirus in the vaccine. Number two, and I thought this one had died out, but now I hear it again. No one's going to track you because you got a vaccine. There's no chip in the vaccine. There's no anything in the vaccine. It is a vaccine, much like we've done for years and years with the flu vaccine. So those are probably the two largest things that are there. How safe is it? Although it came to market fairly quickly, it was well tested, well studied, and monitored, and it's still continuing to be monitored. And I guess the best part of safety that I can say at this point is over 100 million Americans have gotten one form of the vaccine, okay, of the 3 vaccines that we use. And in terms of safety monitoring, I think there's a good example of this in the AstraZeneca that's been sort of stopped in many places, that we're not just letting this run wild. When there is an issue, people step up and they stop it. They look at it, and we monitor it, and we say that's not yet ready to go out to the public. So it's safe. We know that so many million people have taken it. So that's a very good, strong thing in itself.
Yeah, very important points. And I want to spend just a moment, if I could, to have you chat about the asymptomatic spread. And you mentioned it earlier, Dr. Fullum, but I want to make sure people who are watching understand what that means, because there are still, although we're seeing more and more people register to receive the vaccine, which is very positive news, particularly in communities of color in the District of Columbia. There's some who have not, and they feel fine. They live with their families. And in some cases, you got other members of the family who turn up, unfortunately, with contracting the coronavirus. What does it mean to display, or actually not display, perhaps, asymptomatic spread? And what should people and their families be concerned about with respect to that?
Yeah, so about 85% of those who get infected with the virus are asymptomatic, meaning they don't have a fever, they don't get a cough, they don't get a sore throat, they don't feel ill or fatigued in any way. The danger behind that is if you feel asymptomatic, then you may feel that you don't have the infection, so you may be less likely to do the things that everyone needs to do at this particular point in time to minimize the spread. And that is to wear a mask, practice safe social distancing, and get a vaccine. Those are very, very important. And wash your hands frequently as well. When you think about the spread of the virus, and also there's been some talk about the variants that are coming out, right? That there are viruses that are mutating. The virus mutates by way of the infection. So when someone passes the infection on to someone else, that's what gives the virus the opportunity to mutate when it multiplies and replicates during the infection process. And so for 2 reasons. Number one, the ability to unknowingly pass the virus on to someone who may be more susceptible and who may get sick severely. And then number 2, to minimize the process of the development of variants. It's very, very important for everyone to still practice all of the CDC guidelines to prevent the passage of the virus.
And speaking of those guidelines, I think, people have to have been living under a rock, probably not to have heard that you should be wearing a mask, you should be practicing social distancing, you should be washing your hands, as you just mentioned. And I don't want to make light of it, because obviously this is extraordinarily serious, and in fact, it's been deadly. But for people who have been vaccinated, what are the protocols for them as well? I think some folks feel, I've got my vaccination and I can, let down my guard and I can go back to normal. What should they be doing in terms of the CDC's recommendations with respect to folks who've been vaccinated?
So you want to continue with the guidelines. You want to continue wearing your mask. You want to continue social distancing. You want to continue to wash your hands. What the vaccine does, the vaccine really prevents severe disease. It prevents a significant number of people from even getting the infection at all, about 95%, if you want to talk about efficacy. But of the 5%, if you are to get the disease or get the infection, the likelihood is that you won't get sick, but you still can be a vector. You still can pass on the virus to someone who may not be vaccinated. And so that's the importance of continuing with providing and following the CDC guidelines.
So let me add something to that, because I think it's important that not only we're continuing to follow the CDC guidelines, but to understand two things. One is the shift in the virus itself. We're now seeing that the dominant or the major viral strain that we have in the US is the UK strain. It is transmitted faster than the original strain. And there's some evidence that it can be even more infectious, meaning there's more symptoms that come with it now than we previously understood. So one, we need to understand again that it's here, and that asymptomatic, the person who does not have symptoms but can still spread it, can do so now even more quickly than it did before. So that is one thing that I think we need to understand. Because of that, even after you've become vaccinated, you still need to wear a mask, because you now can join that group of asymptomatic carriers, right? So you can still get the virus, even though you will not see those symptoms from it, but you can certainly harbor it. There are two more things on that line. One is look at who might be now at risk for contracting the virus. What we're seeing is a shift away from the elderly population, because we've got 75% of the elderly population has now pretty much gotten their vaccine, so to speak. So now it's the younger population that's becoming at risk. And there's an entire group that won't be eligible for vaccines for a while, and those are children, right? The vaccine currently is limited to 16 and above. And those below that, who are still part of the households, are still at risk for becoming infected. So I think that that's important. The other thing that Dr. Fullum touched on, but I want to also reassure people is the following. The vaccines have numbers tagged to them, 95%, 80%, 72%. You see those numbers running around for the different vaccines. But in fact, every vaccine has proven to be effective. And the three vaccines that we see, Pfizer, Moderna, Johnson & Johnson, in the group who has received vaccination, there have been no deaths from coronavirus for any of the vaccines. So from that perspective, they are all effective vaccines. Okay, so we should know that although there are different numbers for the at-risk group, the real key measure of the vaccine are the following two things. One, deaths, of which there have been none recorded from coronavirus for the people who have gotten the vaccine. And the second one is serious illness that leads to hospitalization. Again, the same. All the vaccines have been very effective at preventing this. So the numbers can get confusing because the numbers are tied to the studies that originally brought the vaccines about. So it's important to understand this. You cannot get coronavirus from a vaccine, one. Two, all three vaccines are very effective in terms of what they do to prevent death and or serious illness from coronavirus. And if there's nothing else I would leave you with, those are the three things. And the only fourth one is you're going to be protecting other people if you've been vaccinated by wearing your mask, distance, hand washing.
Right. Those are very important points. Yeah, I want to make sure that people do understand, because you all both have emphasized the importance of getting vaccinated. But there's some side effects, there's some risks associated with it. And I think people should understand that. I know there's been some hesitancy, not just in communities of color or just among Black people. There have been some questions that others have had about the vaccine and how it might impact them or members of their family, people that they care about. So, what are some of the risks and perhaps some of the side effects associated with the vaccines? I know, I haven't had my second dose yet. I'll be getting that this coming week. But I do know some people in my family who, had chills slightly, or maybe just had to, a little lethargic. What are some of the side effects associated with the vaccines that people should know about, be aware of?
So the most common side effect is a sore shoulder, is shoulder pain. About half will have mild to moderate pain in the shoulder. You might get some redness or a rash in the area of the injection. Probably second most commons are fatigue and headache. Some people will develop a low-grade fever. Some people will have some flu-like types of symptoms after. Most of the time, those side effects occur within the first 1 or 2 days, but can occur up to about 7 days after. Interestingly, and the converse is not true, but the actual development of the side effects to the vaccine is actually the body developing its immune system and creating these antibodies and T cells that will help you protect against the virus. So not that if you are like myself, I had very few symptoms after the second dose, none, just a few after the first dose. But so I don't want someone who has the vaccine and doesn't have symptoms to think that they're not developing an immune response, but the symptoms are really a reaction of the body to developing its immune system to help fight the virus.
And our experience, myself and my staff, has been in conversations that we've had. People have reached out. Seems like hesitancy is slightly more reduced when you've got community partners, when you've got local medical providers, nonprofits, faith-based institutions, and those partnerships that the Department of Health started to push in terms of the later on in the vaccine distribution process. What's been you all's experience at Howard? What kinds of things are you hearing from the types of people who are perhaps reaching out or who are showing up asking questions about the vaccine? Are you seeing, is it your experience that people are very hesitant, or are you seeing people come with family members and that there's a certain level of confidence within the community of folks who are participating in Howard?
Yeah, I think there's growing confidence the more people who become vaccinated. So I think that the partnership with communities certainly have been very effective in getting people out to begin with. What I've seen more and more now are people who are coming in looking for vaccines for family members or friends, right? So within their community, I think the community itself is starting to take hold and saying to others, I got my vaccine, really you should get it. I'm still here, things have worked out well. So I think the communities themselves have been very effective, but I still also believe we have to keep getting the word out. I think programs like this, the more times we can get in front of a camera to reassure people or to show examples that, hey, this vaccine works and that we really need to get busy trying to take care of more and more people. I think it takes a combination of both. So it's not just been one side, it's been both sides. And the other thing I've seen is the younger people are the more likely they want to come in and get a vaccine. But again, we want to make sure we do not forget, as we open up the system to, those 16 and above, there are still a lot of folks who are elderly who have been challenged to get an access. So we've looked at that. And as you talk about community partnerships, I think they're vitally important. We have been asked, for example, to go on the road, to go mobile, to go to other sites to help. And we've been very willing to do that because I think, again, if we're sitting in one place waiting for the rest of the community to come, we're now reaching that segment of the community that is a little bit more challenged in one of two ways. One, getting on the internet piece to register. That's a challenge. And two, just access, mobility, right? So I know we've done an event in particular wards where it's been the council members and the other community organizations that have helped us to organize and bring the folks in because your community best. So I think it takes everybody, and it's going to continue to do that for a while. Okay.
And in terms of things that certain communities should be considering, and you mentioned council members and other sort of influencers have been helpful. Have you seen anything from your colleagues around the country or any other jurisdictions that either the city or even local partners, faith communities or others should be considering to try to help to spread the word and boost confidence within communities across cities to try to get people to get vaccinated. Particularly, again, we talked a lot about, communities of color. I know that, in the District of Columbia, everybody is aware that Black and brown folks have been most impacted by this pandemic, both health-wise and economically. And 75% of the people who've lost their life have been Black residents. Is there things that you all have heard that perhaps we could try to do more of, that you see is actually working?
Yeah, I think the district has done very well, actually, in terms of getting communities together. The pattern tends to be the same. It tends to be community organizations, faith-based organizations that tend to sort of help lead the way out. And then we have lots of sort of these town halls to help solidify that word. The one thing that you see really gaining steam now is the mass vaccination sites. So folks are opening up large facilities. Now in the district, we've done the convention center as one of those, for example. But you're seeing more and more around the country in larger populations of people to try and get this thing done quickly. You're starting to see more mass vaccination sites. I think that's a good strategy. However, the people we want to get to many times can't necessarily get to us. I still think there's going to be a large role for going into communities and making it accessible, even in small groups at a time. So the mass vaccination things work well, but I think especially we've seen some of this from our colleagues at other HBMCs, historically Black colleges that are doing this stuff. They're going out into the communities because they recognize the same thing, which is many of our folks, if they want to get to us, can't get to us. So whereas, for example, if you think about it, before COVID, churches were a great place for mass gatherings, right? You could go to a church and meet a lot. Now we're virtual. So we've sort of taken away a little bit of that avenue. So we can see the faith-based organizations getting the word out, but we still have to get to those people. So that's going to be, I think, something that I see more and more of our colleagues around the country doing, which is to get out and get mobile.
And just, I'm going to ask probably one more question before we turn to John and the folks who are online, Facebook Live, who may have some questions. But you all mentioned a little bit earlier, I think it was you, Dr. Mighty, you talked about young people. And we're seeing more spread, more so with young folks rather than with the elderly population, as I think was the case earlier on during the pandemic. And as the mayor just recently announced this week, relaxing of some of the restrictions in the upcoming weeks, I think May 1st, there's a lot of excitement. There's a lot of excitement in the business community because they've been really just decimated. We've seen so many closures. Our economy's still suffering. Entrepreneurs have had to shut down, restaurants, hotels, and other businesses. And so people are really anxious to try to, sort of turn the tide and open it back up. As we look toward that, what types of things should we be concerned about? I think many people have seen the scenes in the media about, young folks partying in different places, the videos of what was going on in Miami. And some cities have approached this a little differently. So as we look at relaxing some of the restrictions, as the mayor has already announced, what should people, particularly some of the younger people, be thinking about?
I can let Dr. Fullum, he's younger than I, and let him chime in. But again, the one risk that we've seen in the younger population is they want to get a vaccine so they can get back out and mingle among themselves. The biggest caution, of course, is you still need that mask, right? You still need to wear the mask. You still need to distance. And the issue around parties, for example, is simply that in a party setting, you've got a lot of different people. Some are vaccinated, some are not. And you've got a lot of cross-pollination of the virus. So unless everybody is vaccinated, right, it then all falls apart. And so I think as we open up, it's trying to remind these folks that you're still at risk in others who are not yet vaccinated, and that you have to be somewhat mindful about that, and that the parties will come. But if you give this enough time that we get enough people vaccinated and we get control, then we're going to reduce the spread and we're going to reduce the deaths. And I think that's the greatest reminder for them. But that's the biggest risk, is that they've been pent up for so long that they want to get out and about. So the vaccine to them is freedom to mingle. Whereas the vaccine to an older person might be freedom to finally see my family. The youth want to say freedom to see everybody, right? And that's the message, to try and tell them to be patient. And that's a hard message to send, but it's one we have to keep after.
Yeah, I mean, I agree 100%. It just underscores the importance of everyone getting a vaccine. And I'll just add our schools wanting to reopen, our universities, and people coming back to campus and campus life. We're coming back around toward graduation, right? And we're trying to decide to have graduations where people can actually come and graduate together, or whether we should do it online again. So all of that is important. And we're certainly getting that push, if you will, to reopen businesses and reopen our schools. And the answer to that is for everybody to get vaccinated. So if we all have a vaccine, then we can all go back to doing these things with our masks, of course.
Right, and not to get too far ahead, but I think one thing that came up in the conversation I was having with a young lady the other day who had been vaccinated is how long the benefits of the vaccine last. I think there were some questions about that, and I responded to her. But since I've got the experts on here, I'll turn to you all. But she was not aware of how long the benefits of the vaccine last. But I was glad to hear that she had gotten it, though.
Yeah, the data is not yet solid.
Okay.
We believe somewhere between 4 and 6 months. The data isn't solid because if you sort of really think about, we started our programs back in December-ish. So now we're just up to April. So looking at people in the trials, we think that it's somewhere between 4 and 6 months that it might be there. But there are a number of factors that are going to impact this that we're not yet, don't have enough data on, right? So that was with the original virus. Do the variants impact that? So those kinds of things we just don't know yet until we get really large numbers, and time is the only thing that's going to tell. So what I've been telling people is somewhere between 4 and 6 months. We think at least for that long. It probably could be longer, depending again on variants and how well we respond to the vaccines. Okay.
And is there any difference that people should know about? Perhaps none, but I've also heard this question. Some people in families, adults, one person got Pfizer, another person got Moderna. The Johnson & Johnson is 1 dose as opposed to 2. Are there differences in how long the benefits last within those 3, or any other distinctions between besides the fact that Johnson & Johnson is 1 dose versus 2 doses with Pfizer and Moderna, and any others vaccines that are out there?
So
Go ahead, Terry. All right. So, there is some difference between them, but again, the key thing to remember is what we're looking for. When we invented the vaccine, it was to prevent death and to prevent serious illness, and they all 3 do exactly that, whether it be 1 shot or 2 shots, right? The difference was that Johnson & Johnson was initially developed and intended to be a single shot. That's the way they tested it. Whereas Moderna and Pfizer were developed to be 2 shots. And so that's what it became. But again, as I said, they're all effective. And I think that's just a key thing to remember, especially as supplies will surge and wane. They'll go up and they'll go down. And so someone would mention the other day, Maryland just noted that they're going to get a decrease in their allotment of Johnson & Johnson for a bit. Again, I wouldn't slow the tempo of vaccinating folks, because I think it's important that we stay abreast of and try to keep up the pace with the viruses. So I wouldn't tell you, no, I don't think there's any real difference in the outcomes, right, of that we're seeking. And just I think it's also important, many of us now take the flu vaccine. Right. And so folks down in they say to me, well, what's the effectiveness of the flu vaccine? And that's really somewhere between 60 and 70%. Right. And so these these vaccines that we're getting now are easily there or above that in terms of effectiveness. And so again, there should be no real reason why we don't get vaccinated.
Go ahead, Dr. Fullum, you were
I
going.
was going to say, the only thing I'll add to that is, we've not done any trials or studies to compare one vaccine to the other. So when you look at things like, how effective the vaccine, it's really within that particular vaccine's trial, comparing the vaccine against not getting the vaccine. And that's how you come up with your efficacies, if you will. And so the important thing is that it prevents deaths. It's certainly better than not having a vaccine. And with regard to how vaccines are made and how they go, they're very, very effective.
What about somebody who gets the flu vaccine every year and is concerned about whether they should get both the COVID vaccine as well as the flu vaccine? How do you respond to somebody who perhaps has concerns about getting both vaccines? Should they not? Obviously, you all aren't everybody's primary care physician, but in their risk associated with it. But how would you respond to somebody that says, I'm thinking about getting COVID vaccine, but I normally get the flu vaccine. Should I get both?
I'd answer that as being a yes. They're two different, they're two different viruses, right? So the flu virus is one virus and the COVID virus is another virus. So I would tell you that you should get both. What we try to do though is make sure that they're spaced apart. You shouldn't get them both at the same time right now until we know more about the vaccine. So we try to make sure that they're spaced 2 to 3 weeks at least apart, if not more. So I wouldn't get them at the same time. I would get them separately, but they're two different viruses that are out there.
It's good information. John, I'm gonna turn to you, see if we got any questions online.
Thank you, Councilmember. We have a few questions that are coming in, and I still encourage folks on Facebook as well as here on the Zoom platform to place your questions in the chat, and we'll try to get them answered in a timely fashion. To start out, I think this goes right along the lines of the conversation that we were just having. This question comes in and it says, I would like to give a small birthday party for my sister, no more than 10 attendees. All of the attendees, including myself, would have been fully vaccinated by the time that this event would take place. Am I able to give this party for my sister in the next coming days?
So according to the CDC guidelines, and first let's define fully vaccinated. Fully vaccinated doesn't mean you got your shot yesterday and we're all going to gather, right? So the term of fully vaccinated means that it has been at least 2 weeks since you had your second dose of Moderna or Pfizer or your single dose of Johnson & Johnson, right? So let's kind of get there. Now, CDC says that you can gather in small groups with only vaccinated people, right? Together, not anyone who's not vaccinated.
Dr. Fullum, would you like to add anything?
The only thing I would add is in that group, I think we're assuming this, but let's go ahead and state it. That group has to be isolated, right? So it's not a group that's going to Chuck E. Cheese's, right? This is a group that is in somebody's house, isolated, away from people who may not be isolated.
Yeah,
and please remember, when we have gatherings like birthday parties, we overlook the fact that our kids are there. Yeah. They count. Okay, and they count currently as the unvaccinated population. And although their risks are minimal, we are seeing again an uptick in the number of kids who are being infected and being symptomatic. So do not neglect that population. They count.
Thank you, Dr. Mighty. Next question came in. It says, Dr. Mighty, are you saying that even though one person has been vaccinated, that vaccinated person can carry and infect those who have not received the vaccine? Or did I misunderstand your comment, Dr. Mighty?
No, that is correct. The reason we're asking people to continue to wear masks, even after they themselves have been vaccinated, is that the fact of getting vaccinated protects the individual who has been vaccinated. We do not yet know that it eradicates the virus from being carried, just as an asymptomatic carrier would. So the caution right now is still, yes, you can potentially infect someone else, even though you yourself has been vaccinated.
Councilmember McDuffie, this question is for you. The question says, what is our local government doing to ensure that people have equitable access to the vaccine within the District of Columbia?
Well, I mean, I think what they're doing today is different than what was being done earlier on, but I think they've taken a number of steps to improve vaccine equity. And as I mentioned earlier in my opening remarks, we've really worked hard to amplify the voices of residents throughout the ward, Ward 5 in particular, but then throughout the city as well, who are having challenges early on. I think the challenges that we saw early on with accessing the portal for folks who did not have internet access, folks who had slower access than others, folks who had to go and use a phone and wait for a while. We've seen those types of concerns diminish significantly. Alternatively, what we've seen is DOH partner, as I mentioned, with churches, partner with local nonprofits, even going door to door to help to register people. And those are the types of things that I think have helped to boost confidence and help to spread the word in those hard to reach communities. And so I think we're seeing equitable access to the vaccine improve over time. And I'd like to see it continue to improve, frankly, and just as we monitor what the CDC is recommending, we should also be monitoring what best practices exist or what other jurisdictions might be doing that we could pull from that might suit us here in the District of Columbia.
Let me add that we at Howard as well, our faculty practice plan, we reach out to our patient population. As you know, Howard serves the underserved in the District of Columbia. And so we also reach out directly to our patients and encourage them to come in and be vaccinated.
Thank you for that. Question from our Facebook audience. Do you all know when the CDC will give an opinion of how long after you have been fully vaccinated will you have to continue to wear your mask?
I have no clue when the CDC is going to render an opinion. If you want to use a general guideline, that the target number for the nation is 70% or better, right? So when 70% of the nation has been vaccinated, we think at that point we'll be approaching that thing we call herd immunity, where transmission of the virus can be seen to be at the minimal level, so to speak. It will not stop it entirely, but majority of people who would then encounter the virus would have been vaccinated. Until we get to that level, then I don't even believe that we're going to necessarily see a change. But the CDC maps and monitors this pretty much daily, so they're going to have more insight than the rest of us into where we are going to be in another couple months.
Thank you for that. There is another question that just came in. It says, did we already discuss grandparents who are fully vaccinated? And what does that mean for grandparents visiting family members, especially small children?
Let me see.
Under 3 years old.
Yeah, I'm going to take a stab at that because I had to read it this morning myself. I had to go back and think through that question came up this morning. So again, grandparents and families, right? So grandparents are been vaccinated. We've protected grandparent, right? So grandmom and grandpa are protected. Now, you go in to visit a family. I think these are general guidelines. If you go into a family unit and they themselves have been vaccinated, then that's good, right? You can take down the mask and you can mingle together. If there are children in that family of very low risk, I think it's a family decision as to what you do then. But if there is a high risk individual, a child, let's say, in that environment, you should still wear a mask. The other important thing is, remember, many grandparents have multiple family units to interact with. So again, recommended that you don't necessarily bring those family units together at the same time, again, because they may be folks there who are not vaccinated. So it's a matter of caution and common sense, I would say, that if you have an at-risk child in that family, you would still want to wear your mask and you should have distancing. And other than that, it should be a limited amount of exposure to them. Whereas grandparents and adults who have been vaccinated, the general rule of the CDC would be you could gather without mask in that space.
Got it. We have another question that just came in. It says, given that there is not a vaccine for children, particularly small children, do you think that increased and accessible testing will play a larger role in fully reopening schools?
That's a great question.
Great question.
No, that's a great question. So I think that the overarching answer is yes. If you're going to reopen schools, you want to still remember that kids are at risk, right? Now, to the credit of schools that have been open and that have practiced pods, having smaller group of kids together in classrooms, wearing masks, distancing, barriers, hand washing, they have shown that the risk of transmission has actually been fairly low in the school setting. However, those kids go home. And in the home setting, it seems to be a stronger, correlation between picking the infection up at home and bringing it into the school, right? So to get to the core question is, would I think testing would be advisable or would help if you're going to reopen on a large scale? The answer to that is yes, because testing will allow you to identify the group at risk and remove that group temporarily, if you will, to keep the rest of the school pretty much open, right? So there's not just testing, but there's going to have to be a structure around testing. And let's say podding or grouping your kids in a way that don't have them just cross-pollinating at wildly, right? So, but I think testing is going to be very valuable to reopen in schools in a large way.
Yeah, contact tracing, and also the teachers and staff need to be vaccinated as soon as possible as well, because that's another potential avenue for infection.
Thank you for that. Dr. Fullum, we have two people that have jumped in, Commissioner Robert Branham, and one of our another Ward 5 residents has asked us about talking about the residual effects of the profile of long haulers and why it's necessary to get the vaccine, and just giving some more information about that.
Yeah, so we're starting to see it. As a matter of fact, there are certain areas in the country where they're actually developing clinics to evaluate and manage these long haulers. I don't know that there's a lot of evidence out there to be able to predict who will develop the chronic COVID syndrome, if you will, or to become a long hauler. Early on, we thought it was those who had significant illness, right, had to be hospitalized, intubated. Now, for those patients, we're seeing post-traumatic stress disorders, depression, anxiety at a higher rate than others who are infected. But with regards to some of the chronic fatigue issues, the shortness of breath, palpitations, headaches, we're seeing that pretty much across the spectrum, even in those who've had mild disease, as well as those who have had severe disease. So not able to predict it, and not really sure of a word that we use, pathophysiology, or the cause of it, although there's some evidence that there may be some micro clots or blood clots that are developing in the very, very small blood vessels of some of the organs like the heart or the kidneys or the brain or in muscle, that may be damaging the muscle of the heart or damaging the muscles of your arms and legs, so to speak, use as an example, that leads to these chronic syndromes. How long they last, whether or not they resolve, we've not been able to follow them long enough yet to really see, but it seems to be definitely chronic and seems to be persistent, and it affects young people as well as old people as well. So still too early to give a lot of definitions around it as far as the risks, but it's a significant problem that we're starting to see in those who develop it.
Awesome. Dr. Mighty, this question came in for you on Facebook, It says, Dr. Mighty, do you recommend or suggest that individuals that receive the vaccine register with VSafe after the vaccine health checker, after vaccine health check CDC established?
Yeah, I think it's important that we track through the CDC has one, many local governments have them. It helps us to understand a little bit the side effects, the profile of things that happen post, and also will probably be a way to develop future policy. So the question that we get a fair amount, that I'm seeing a fair amount, is, are we going to need a booster? And we're not going to have an answer to that, right, until we get more data. But being able to get that data and then able to transmit that back out to folks, these kinds of databases or activities help us to gather information more quickly, and therefore to turn it back around. So I think it's a reasonable thing to do. Yes.
Wonderful. This question can go for both of you. How confident can a parent feel about having their child participate in outdoor sports?
I'll let Dr. Fullum do that one first.
So,
I
think outdoors is the key word. Being outdoors is a little bit safer than being indoors, but the more of the contact, right, the higher the risk. I mean, we've seen it with professional sports. I think if you're out and you're playing tennis and you're on one side of the net and your opponent's on the other side of the net, you're probably okay. But once you walk away from the net and go to get together, you need to put your masks on. So I think you just have to be safe and smart about it. If you're out running and no one's really around you, you don't necessarily have to wear a mask. But once you come inside or get around other people, then you need to put your mask on.
Yeah, so so what you've seen is there is some variation in the qualifications, what kind of sport.
Yeah.
Right. So the more distance you can have, if you're out playing golf and you can keep people way apart, that's one thing. When you're in the lacrosse field or football, we've definitely seen spikes in those things across the country. So you're seeing it in sports, and you can take that, what we've learned from, look at the baseball teams. All right. And the Nats they missed 3 or 4 games in their opener. Right. So you've seen it in the professional teams and in college that when folks got together, there was an increase in transmission in and around that. So outdoors is good, but depending on the type of sport and the ability to distance in around that sport is going to drive the transmission and therefore the infection rate.
All right. We have another question that's come in. It says, what impact does having COVID have on the immune system, if any?
So there are two things, right? So one is some folks, just like the common cold or just like the flu, some folks get and fight it off pretty well, and they have a very efficient immune system and they sustain it. And others, in this case of COVID, we're seeing that quote unquote long haulers, or really what you're talking about when you talk about long haulers, or chronic diseases that develop because of exposure to the virus. And so it's going to vary by your own innate ability to defend yourself, or the body to defend itself. So you're going to see a different variety of things depending on how your basic immune system worked. All right. So the real thing is that we mount a response, but COVID is relatively new, right, to everyone. So it's the fact we don't know how to mount a response to the virus. So the people who responded and overcame it, because remember, most of the people who got COVID didn't die from COVID, right? A significant portion have. So some people have been able to overcome the virus. And we don't talk often about the recovery, but there are more people who recover than die from the virus, right? Disproportionately, unfortunately, folks of color were in a higher proportion of those who die from the virus, okay? So you do mount an immune response. The question is it adequate, and how long or how sustained is that response that you have?
And the spinoff to that is, if I've had coronavirus I've had symptoms and I recovered. Do I still need a vaccine? And the answer is yes. You still need to have a vaccine.
All right, I think that is all for our questions. I'm sorry, we had one just come in, and then I think that'll close us out. Is it more important to focus on clinical trials relating to the vaccine rather than studying how people are coping after COVID-19?
You both.
Yeah.
All right. So what the clinical trials help us to understand is more focused questions that you're not going to be able to understand just by seeing it in the open, right? So if we want to know how effective is Pfizer or Johnson & Johnson, so forth, you can track the numbers over time, right? We've seen now that we've settled into the 80 to 90, the 90% range for Pfizer in terms of effectiveness, in terms of how many people actually get infected with coronavirus after they've been done. If you want to know the performance, especially if I wanted to ask the question about performance of vaccine by type of vaccine and by ethnicity and by age, that's much more of a focused clinical trial, number one. In the proactive mode, there's still going to be more vaccines, right? Novavax has just concluded their vaccine trials. Still very important in the trials to know who did they include in the trials, how well did it work? Because as we learn more, we may find that one type of vaccine might be more effective for one population group versus another. So I think it's still important to have trials, but the real number, the real world number that we're going to develop is looking back on these 100 million Americans, of which I'm a part. We're all kind of a part of it, right? We're in the world's largest clinical trial ever conducted, right? But it's important to know in the real world, how effective are these things really at preventing severe disease and death? Those are really the markers that I think we have to go after.
Thank you for that, Dr. Mighty. Councilmember, we'll let you take it away.
Appreciate it. Thank you. And thank you both. Before I sort of close out, I just want to give you both an opportunity if you have any final thoughts to offer. There are a lot of important points that we made over the course of this hour and great questions from folks who've been participating. But Dr. Fullum, Dr. Mighty, any final thoughts?
Yeah, I mean, I think the important thing is that the vaccine is safe and effective. I think at Howard, we vaccinated over 25,000 people, and you know, Dr. Dean Mighty and I are there every day and evaluating these patients, and the side effects are minimum, and nobody's died from the vaccine. And then the second thing Dean Mighty has said over and over again, which I think is the most important thing, is that the vaccine saves lives. It prevents death. If you get the vaccine, you are not going to be hospitalized with COVID. You are not going to die from COVID. And then the third thing, not only will you be saving your life, but you may be saving the life of someone in your family, someone very dear to you.
Dean Mighty?
I echo that. The most important thing I always tell to folks is you will not get COVID from the vaccine. I think that's so important to understand, because that is the number one thing that I see is, am I going to get COVID? No, you're not going to get COVID from the vaccine. And number two is around just the fear of the vaccines itself from being developed so quickly. But I point back to, although AstraZeneca's had its problems, one of the reasons we know about those problems is because it's being monitored so closely. All the vaccines are being monitored very closely to see and to make sure that if a significant symptom side effect develops, we will know about it and take action.
Again, thank you both. I really do appreciate it. This has been a really important discussion. And so I'm thanking you both. I want to thank all the folks who joined us both on Zoom as well as Facebook Live for your attendance and your important questions. Our office is going to continue to advocate for an equitable vaccine process and also working to provide information to residents that helps to address their questions, any concerns. But importantly, although it's been more than a year that we've had to live throughout this pandemic, we are not out of the woods yet by any stretch of the imagination. So please remember to wear a mask, practice social distancing, wash your hands frequently. And you both have said it, Dean Mighty, Dr. Fullum, repeatedly over the course of this hour, but the vaccine saves lives. So please get vaccinated, do your part. Help yourself, help your family, and help our community. Again, thank you to everyone and stay safe.
Thank you.
Thank you, sir. It's been a pleasure. Thank you. Take care now.
Take care.
Thank you, Dr. Fullum. Thank you, Dr. Mighty.
You're very welcome.
You're welcome.